All right, take two. We're going to try to add Brandy on. She's our office manager at our clinic. We just tried this the first time and it was not working. So we're going to do this a second time. And we're going to hope and pray to the gods of Facebook that it's going to work this time around. So let's see. Let me see. Brandy, add, bring on camera. It says adding. Brandy, let me know. Hopefully you can just join me live. You have good signal and all that good stuff. And so here's what the topic is. Here's what it was. I came up with this topic. I had it drawn out on a dry erase board, but I didn't have time to go through this. So I just decided I would cover it while I'm on the way to my dentist appointment. All right, focusing on the road, but having this play in the background. And looks like Brandy's not going to join us this morning. So sorry, Brandy. Sorry, Brandy. Your cell phone is subpar. I'm so sorry. It's not working. Brandy and I have this ongoing little joke about herself. She even has two cell phones. She actually got a second cell phone just so she would have adequate cell phone reception in the clinic because her other cell phone wasn't going to work in the clinic. Anyway, it's a long story, but she's cursed with having issues with technology. But here's what the topic is. The topic is as follows. If you're a chiropractor that wants to have a better patient engagement, and I wrote, read that as PVA. I don't like using the word PVA. I just think it sounds scumbag-ish. I know it's not. I know it's just a statistic. It's patient visit average. It's how many times your patients come in. And I thought about this because I had a patient yesterday that she's on her 10th phase of care. She's been seen 182 times. And I mean, I say that because, granted, she's been a patient for 5 years. So it's not like that's in 1 year or something crazy like that. I see her every 3 weeks. But she's going through a ongoing corrective phase of care. She does homework at home. She's functioning great. She's doing well. She's made some structural improvements, somewhat plateaued, but we're pretty much just keeping her out of trouble. And she does well. She has some different digestive issues that seem to do much better while she's under chiropractic care. She's played with it a few times, and when she abstains from spinal correction and getting adjusted, then her problems get worse. And so she is dedicated to just doing what we recommend to do for her well-being. And so it got me thinking about a lot of our current patients and how they go through care and the process they go through, and then comparing that to other systems or how a lot of other chiropractors do things out there, or how they were taught to do things. And this is also a culmination of conversations that I've been in with Brandy, who's our office manager at our clinic. So she asked me questions. She says, how many chiropractors do you think have some sort of goal-oriented, structured type of care for their patients? And I said to Brandy, well, let me think. How many people have some sort of structure, like a day one, day two, or any sort of just process versus come in for your pain. When your pain goes away, you go away, and I'll tell you to come in once a month, and then you won't, and then I'll say I have a low PVA, or I'll say I fix people really, really quickly, and all those other chiropractors that see someone more than 6 visits are the devil. Like, those are the different directions that a lot of us chiropractors go. And so I answered that for Brandy, and I said probably 25% if I had to guess. I would say probably about 25% of the chiropractors out there have some sort of structured, goal-oriented care that they render to a patient. That's more of like a long-term thing and not just symptomatic care. And I've talked about this topic before, and if you ever want to jump on and discuss this and have a friendly debate, I'd be happy to talk about it. But I'm pretty confident in my stance that in 6 visits, if your goal is to provide some sort of long-term stability or motivate your patient to make changes in their lifestyle, change the way that they're living, if that's your goal, it's impossible to do it in 6 visits, and you're not doing it. But if your goal is just symptomatic relief, just make someone's lightning bolt in their butt go away, then you could probably do that in 6 visits. I mean, heck, I've done that in 2 visits. I've done that in 1 visit. I had a patient that had vertigo for 8 months, went to 3 ears, nose, throat doctors, had multiple MRIs, CT scans, one atlas adjustment, her vertigo went away. Did I fix her though? Well, I made her symptom go away, but her spine was a mess. She had a bunch of predisposing factors as far as why her spine was in a weakened state, and she will repeatedly and predictably have other spinal and likely health consequences if she doesn't get her spine stabilized. And so even though her symptoms went away right away, I made it very clear with her, yes, we got the symptom to go away, but we didn't fix you necessarily. That's a very important distinction to make. So now back to the original topic at hand, but before we get into that, real quick, if you haven't checked it out yet, we made a 30-minute pre-recorded demo of a behind-the-scenes look at our doctor training portal. And so if you go to demo.movenowyou.com, you can watch it. Now, a little caveat, and if you're not a member of Move Now University, you won't really know the difference, but we've actually added even more to it since this demo. But the demo is still pretty cool because it shows you how it's structured, how it's laid out, the whole journey that you and your team go through to learn this and implement it. But we've added this whole other implementation process that I've spent the last probably 6-7 weeks on, and that's up and running too. So I'm gonna make a new demo video very soon so that you can all see that. But in the meantime, if you haven't seen anything, you should check that out. Okay, let me try adding Brandy again just by chance. It says my viewers, and yeah, no one's listed on viewers. I'm gonna blame this on Facebook and not Brandy. How's that, Brandy? I'll let you go. Okay, so now here's the whole thing I was gonna talk about. If you have this super low PVA and your patients are not engaged, and they're not sticking with you past the symptom, there's a couple of different issues with this. It's not just one issue. There's a couple different issues. One is you're not establishing or making a precedence in the very beginning of care as far as what you do and what you stand for. So if on day 1, day 2, day 3, you're talking all about their symptoms and that's all that you're focusing on, and then you get them feeling better, and then you try to start talking about what long-term stabilization and correction and building strength and all the stuff that we're about. Like if you start talking about that after they're already feeling better, you're backpedaling and you've usually lost them. And now at that point, they're like, yeah, doc, I'm feeling pretty good. I'll come back when the lightning bolt comes back. And then you've lost them. However, if you talk to them before you even get into that, so if you say, look, here's what could happen. We could go back, we could do an exam, take x-rays of your spine, pinpoint what is causing your symptom right now, and probably even dig deeper and find what could be the underlying cause of your problem. What could happen is we could go in, we could start making a couple of adjustments, get some irritation off the nerve, get the joints moving better, and your symptoms might decrease rapidly. But you said you've had this problem for 20 years. Is that right, John? Yes. Okay. So do you really think that in 2 or 3 adjustments, that's going to fix 20 years of wear and tear and possible osteoarthritis and all the other stuff that we have yet to be seen that we'll see in a few minutes when we go back and do an exam and likely take x-ray? Do you think a couple of visits is going to fix a lot? No. So you have to pre-frame it and start talking and thinking in that direction from day 1. That happens in the new patient consultation. Why do you do that? Everything that I'm talking about and everything that we teach, I feel very comfortable doing because I feel like it is the most ethical way to communicate with someone, because ultimately at the end of the day, what are you trying to do? You're trying to make an impact in this person's life that is lasting. And in their entire circle of influence, everyone that they've ever met, they're so overwhelmed with joy that they cannot help but talk about what kind of transformation they've made, how they didn't know this stuff before, and how you and your team enlightened them. Okay? That's the goal. You aren't going to do that if you are desperate for that person to start and see you in the office, if you are caving to whatever they say they want or don't want, and you let them push you around. If that happens, you fall victim to that whole scenario of trying too hard for a patient to like you instead of a patient to respect you. And And that's just it, is that patients don't have to like you, they have to respect you. As a result, they will like you, but they have to respect you first. So now that's one little piece of it, is starting off on the right foot. Okay. Second part is now reviewing everything that you find with them. So we do that on day 2. We review what we find with them, and the patient has a choice. We present the choice. I just did this yesterday. It's called a BROF, Brief Report of Findings. I did this yesterday with a couple who I started, and interestingly enough, it's husband and wife. The husband has been to a well-known Gonstead chiropractor for years. The wife worked for 6 different chiropractors. Kind of an interesting couple. They're probably in their late 50s, I'm guessing, maybe early 60s. Okay? And the deal with them is the husband, his spine is in bad shape, severe degeneration, severe posterior thoracic translation, reverse lumbar curve, just a bad spine. And periodically his low back would go out. That was his symptom. He'd go in, he'd get a really specific, good quality Gonstead adjustment. His symptoms would go away. So he loved Gonstead. So he was trying to find a Gonstead chiropractor. He moved here just a little while ago. And so he came and found us. And so I take him, our staff takes him on a tour in the clinic, and our clinic looks very different than a typical Gonstead clinic. We still have changing rooms, and we have full spine x-ray, and we have all the stuff that a Gonstead clinic would have, but we also do chiropractic biophysics, so we have all this traction equipment. And we also do functional movement, which is everything we teach inside of Move Now University. And so talking about strength and posture and movement patterns is just different. And so I sat down with him in his consultation, and I said, look, I know you've been seeing Gonstead chiropractors your whole life, and that's awesome. That's what we do here. That's what I do. However, there's some things in this model that we do here that are very different. And just a side note, everyone that's watching this right now, listening to this right now, you don't have to do Gonstead to be able to resonate and parallel what I'm talking about here. I'm using this as a real world example, just so you understand like how patients think about this, okay? Because it could be an upper cervical technique that someone's in love with, and they come in and see you, and you might do upper cervical, and they refer to you, but you also do corrective work. You also do functional movement. So anyway, in his consultation, I'm talking about what we might see on x-ray. And I tell him, I say, look, if you want to just come in here and be seen every once in a while when you have an ache or a pain, you can totally do that. And I can take care of you for the rest of your life. Okay, I can totally do that. However, if you have something structural going on, or if you have something movement-based going on, or a combination thereof, and you want to just come in when you hurt yourself, just know there's other components that we specialize in that we could be addressing so you don't hurt yourself as often, so your spine doesn't continue to break down and degenerate at a predictable rate, and you don't have to suffer from all these exacerbations as frequently as you have been. Okay, and you could live your life with more confidence, knowing that you're doing something to slow down the process of your spine losing the battle with gravity. And I said, those are going to be your options. We're going to check you out first. I want to put the cart before the horse, but I'm planting the seed. So then he immediately refers his wife in. His wife comes in as a patient. She started last Friday. So yesterday was their brief report of findings. It was the first time I was meeting with them. Okay, and so, let me just see again if I can add. Yeah, weird, it's Facebook. Okay, I'm just checking to see if I can add Brandy as a viewer, and it doesn't show any of these other viewers on here. It's so weird. Facebook, why are you doing this to me? So anyway, yesterday I'm doing a brief report of findings, and I'm talking to these patients, and the wife's spine, she's got a lot of stuff going on in her neck. She's worked for 6 chiropractors, never seen a Gonstead chiropractor before. And husband, I just told you his story. His spine's in bad shape. And so prior to them coming in and going through their x-rays, we have our patients watch a report of findings video that we made, and we've scripted this out, and we have a template for it. And that's one of the few videos that our Move Now doctors have to make, okay? Most of the other stuff is all made for you, but that's one of the few videos you have to make based on how you specifically practice, and we give you template and guidelines on how to do that. And then they watch the video. It explains a lot of things of what they may see or may not see. And then they come in and we go through their x-ray, and I go through it with both of them and I present it to them just as I would. And this is why, going back to the original topic, why a lot of chiropractors suffer from this really low patient retention engagement PVA is because you're either not even offering any sort of corrective work or rhyme or reason or objective measures to gauge someone's progress through a supposed corrective care plan that you're going to present to them. So that's either option A, you don't even present that, or option B, you tell a patient this is what you're doing and you force everyone to go through the same process without actually making it their choice. Okay? So I always present it as a choice. And when you present it as a choice and it's a really good choice and patients see that, 99.9% are going to choose, they want to go through the corrective work, but they're saying it. You're not saying it. They're saying it. So then at that point, I present the choice. How do you want to handle this? What do you want to do? Either we just see a few visits, or the next step is we go through and we do a movement assessment, and that completes the analysis process so that we know what's going on from a segment, posture, and movement standpoint. And then we can get all our ducks in a row. We can figure out what to do, and I'll put together a game plan with you for your next visit. And they say, yeah, that's what I want to do. I definitely want to do that. Okay. And then you can ask a little further and say, I'm curious, why? Why is it that you want to do that? And then they can talk about all the things that they want to be able to do. Well, I want to be able to hike and go on cruises and do this and, live a life without pain and suffering. And I want to be around for my great-great-grandkids and all the cool stuff that they have. That's the why. So capture that, hold on to it, because here's what happens. People say that because there's this really good feeling of like, yeah, I'm going to do all this stuff. It's like why people join a gym and they never show up to a gym. Yeah, I'm going to join the gym and I'm going to work out and get in great shape and gain muscle and lose fat, but then they never go. So here's what you got to do. When they say that, you got to capture that, because the next visit, so to speak, is where they put their money where their mouth is. They're committing. They're making a commitment. All right? They make a commitment when they say, I'm going to schedule and I'm going to pay for care. And there's nothing bad. There's nothing where you have to feel dirty about talking about money or anything. Money is just an exchange of value, right? I mean, your services are valuable. It's going to transform their entire life. But they have to be able to see that value to exchange money for your services. That's when they actually commit to care, not when they say it on day 2, but on day 3 when it actually happens. And so then what happens is on day 3, if there's any backtracking on their part after you've mapped out everything for them, you can reflect back to what they told you on day 2. Now, a couple other points I'm leaving out, and we go through this in extensive detail inside of all of our training, but we also talk about time and money on day 2 before we get to day 3. So based on the information we know, whether it's an insurance patient or non-insurance patient, we give them an approximate estimate of cost and we go through a time frame. And then we handle any objections or concerns they have right there, so that day 3 is not a sales process. Day 3 is just confirming and showing them the details of what they said they already wanted to do on day 2 and just getting them set up through this process. Now, that's the first part of getting people engaged, is just having a process like that. But the other 2 pieces of this, and they kind of wrap together, but the other 2 pieces of this is patients have to have significance, feel significance, be part of a community, and have something where they can excel and compete, engage their progress, and what's the word I'm looking for? Like elevate through this process, rise through this process. So how do we do that? Well, we have this thing called the 12-week transformation. So our patients get access to this 12-week program that we built. We also clone this for all of our Move Now University members. They set this up in their clinic. They can customize it as they want, but it works right out the box because we rebuilt this whole version that works for all Move Now doctors on behalf of the sub-brand of Move Now University, not Jones Chiropractic, for example. And there's a big power of sub-branding. It's a very well-known marketing strategy, and it works. It's having a parent brand, which is your clinic, and then having another product or service, which is a sub-brand operating underneath of it, and it actually gives more validity to the parent brand. So it's a very interesting phenomenon called sub-branding. But anyway, so this whole 12-week transformation is sub-branded, it's used, it helps guide the patient through, helps motivate them, and then you track well, you set goals and you track goals, and that's another thing that we do with our patients. And then you have a way for them to compete and excel and see their progress. They progress through a process. We have what's called the belt system of functional movement. And really, the belt system encompasses how they're doing with their corrective work as a whole. It's called the belt system of functional movement, but it really tracks just a lot of their improvement and their successes through care. So another thing that we track too, the wellness score. We use a cash practice wellness score. So very beginning, patient has a grade. They resonate with that very well. They understand that. And then we compare the wellness score. So they have a comparative wellness score. So they have an original score, and then they have a follow-up score. And the goal is to improve 15 to 20%. That's what we found usually across the board people can do if they work their, what's off. So anyway, that keeps people going. And in the past, I didn't used to do all this stuff, and I didn't have a great retention and a great PVA, and people would drop out of care, and I would just think they didn't get it. But the thing is I didn't get it. I didn't have the systems. I didn't put the time and the energy, very well spent time and energy, by the way, into something that was going to make sure these people successfully went through care so they could actually get the changes that they were looking for. So that's it. That's what I want to cover. Hopefully that's helpful. Give me a thumbs up or something, or comment or ask a question. But I hope this is beneficial for you. And if you want to see a 30-minute behind-the-scenes demo of how our program is set up, go to demo.movenowyou.com. I linked it up above as well, and you can check out a 30-minute pre-recorded demo, find out a little bit more about how this stuff works. We're looking for like-minded chiropractors who resonate with everything I just said and want this for themselves. And we're building an army. We're taking it back, and we're changing the face of chiropractic to up the level of clinical excellence, because our profession deserves it, and our patients deserve it, our communities deserve it. So that's what we're about. Hope you enjoyed it. We'll talk real soon.